Hey everybody, how's it going? So, some of you might know my girlfriend is going to be helping me in the OR eventually once she gets her NP license. So we were gonna get started with just teaching her how to suture a little bit. If you guys are interested, you can try doing this at home, or if you're interested, I'm always glad to host a workshop or something. But if you're gonna try it at home, you just really need any sort of animal from the grocery store. We got a pig's ear here. It just has to have enough dermis to be able to suture with. And then you need a needle holder, a pair of pickups, a good pair of scissors, and some suture. And we got some leftover suture from our OR, so that's what we're gonna use. Typically, you don't wanna use the permanent sutures for deep dermals, but since it's just for practice, you can feel free to use whatever you like. So the layer we're going to be working with is the dermal layer. Here on top you can see this sort of thick epidermis. Underneath we have this nice thick dermis that's a little bit lighter in color than your epidermis. And then underneath, the pig doesn't have too much fat, but you can see a bit of a muscular layer here. So this is what we want to stay away from whenever we're suturing deep dermals. You really just want to enter in this plane between the muscle and the dermis. And then come out more superficially, closer to the superficial edge of the dermis here. So you'll see that in a second. So the first thing when you're suturing is you want to make sure that everything is stable. You don't want to be swinging around your needle or anything like that, or stabbing people and giving them hepatitis C. So typically what I will do is I'll use my pinky finger to stabilize myself. So when I'm using the pickups, I'll stabilize myself with the pinky finger here and then do whatever else I need to with my hands. And then same thing when I'm using the needle driver here. I'll stabilize myself with my pinky finger if I need to, and then do the work that I need to do. So what you want to do is grab the dermis and epidermis and then pull it up fairly taut. What a lot of people end up doing when they first try to suture is they end up pushing it down. So they try to drive the needle in and then push the tissue down towards the needle. You actually want to pick up on the tissue and then drive your needle. That's why it's a needle driver in the correct plane. You also want to make sure you're either pulling straight up or slightly forward. You can go slightly back if you're a little more advanced, but most people when they start out, pulling back on the tissue actually makes you tend to buttonhole because you're overlapping the tissue onto itself back here. So when you take a bite of it, you tend to go through and through before you come back out again. So you don't want any of the suture when you're doing your deep dermals to come out through the skin. So it is better to either make sure you're coming straight or coming a little bit forward. So how we want to place the sutures is you want the knot to eventually end up deep. If it ends up superficial, it'll irritate the patient and it has a higher likelihood of becoming extruded. So the way you want to make sure that your knot ends up deep is to place your first bite on one side of the tissue from deep to superficial. So this is the superficial dermis here, this is the deep side. You want to come in on the deep side, but not grab any muscle. If you grab a ton of muscle, what ends up happening is it ends up inside your knot, and if you constrict that muscle, it can end up killing it. Usually it's fat underneath, so you end up killing the fat. So you take a bite in the deep dermis, and then come out superficially. So the angle I have right here is about 45 degrees. Some people advocate doing it 90 degrees. I don't think it really matters as long as you're getting a good bite of the dermis and can really lift everything up. So I tend to take it at 45 degrees just because I can angle the way I tie it down. So we'll go from deep to superficial. And then we'll do the same thing on the other side. You want to grab your tissue here very gently. You also don't want to pinch the tissue to crush it. You'll approximate it to the other side, figure out where your other bite's supposed to go in, directly across from where you came out superficially here. And then on the opposite side, you want to, again, evert it, but not fold it over, double it up onto itself. You just want to sort of lift it up and then come in superficial to deep. And again, I sort of came out at about a 45-degree angle, came out through the deep dermis and did not grab any of this muscle fiber here. So then you pull your stitch through. And you can see as you pull it together. So now that we've thrown our suture, we have to tie it down. A little bit about suturing, or tying the knot down at least. You have a long side, so you have your long tail that attaches to the needle, and then you have your short side. Typically, the fastest way that I teach medical students is that you want to take the long side, put your needle driver in between the long and the short, and then throw it over towards the short side around your needle driver, take your needle driver and pick up the short side and then pull it through from the short side, being on the downside here, to the upside. So you pull the short side to the opposite side, and that'll lay your knot down flat. So if you just do this, it won't always necessarily pull your knot down completely tight. Right here it is, but because I put the 45-degree angle in when I take the bite, with the deep side a little bit on our right side here, you can actually pull to the right side and it helps cinch it down a little bit more. I don't know if you guys can see there, but when I pull a little bit to the right, it's pulling the superficial tissue again together to approximate it very, very well. And then after that, we just cinch down by pulling the long side up, and that'll sort of lock our suture into. And now we'll go ahead and finish tying it down to make sure that our knot stays nice and secure. So I'll take the short side and then pull it downwards to the bottom. Again, long side, throwing over the needle driver, grab the short side, pull it upwards. Same thing, needle driver in between, take the long side, throw it over to the, or over the needle driver, and then grab the short side and then pull the short side from the top side, now to the bottom side. And then typically for this, you'll want to do it about 4 times, but since we're just doing it for practice, we'll do it a bunch of times to sort of show you. So over towards the short side to the opposite side, long side, over, grab the short side, pull the short side to the opposite side, and then you just keep doing that back and forth and back, and back and forth. And that way you'll get a bunch of nice knots underneath. So you can see here that after we take the scissors and cut our suture, I'll leave a little tail in here just so you can see it a little bit better. But you can see that the knot sits deep underneath the tissue. The origination of the knot is in the deep tissue, so has a less likelihood of extruding or coming up through the skin and spitting, or being pushed out sort of as like a pimple. So the best way to, get good at this is to just keep practicing and keep trying, and then, depending on how you're doing, you'll have somebody sort of watch you and critique you and, make sure that you're doing better. So I'll go ahead and show her another one here. So we're gonna grab the tissue gently. I stabilize myself with my ring finger this time. We take a look at the tissue, look at where the muscle is. I'm gonna come in at the deep dermis down here, and then come out through the superficial dermis. So we also want to make sure that we didn't buttonhole on the other side, so you don't see the needle coming through, which is good. I'll load my needle, and then you also want to load typically at a 90-degree angle or just over, so that it helps you sort of advance your needle. And then, how you want to hold your needle driver is ring finger will be on one side, your thumb will be on the other side. Your long finger will be stabilizing the needle driver from the side, and then typically I'll leave my finger at the sort of cross section here. Or you just palm it if you're lazy and you've done it for a while. So we take our tissue, approximate to the other side, adjust to where we think we're going to enter in directly across from where we came out. So it'll be about right there. I grab the tissue up here, come in superficially, and then I come out, pivot my wrist to bring the needle down, and then you can see the needle coming out right here in the deep dermis, right between the dermis and the muscle. So we'll pick it up here, pull it through. And then again, needle driver will sort of be in between. We throw it over, and then we grab the short side, and then we pull through. Approximates our tissue together very well. So again, we throw over towards the top side and then pull down. Throw over towards the bottom side, pull the short tail up. Throw over, grab the tail, pull towards the downside. We'll do this a couple times.
How many times do you normally do it?
Typically about 4. Yeah, I just did a little bit more here just to show it. But here you can see the knot sitting underneath. So typically with these, I'll actually cut the tail very short right against the knot. I cut it a little bit long here just so you can see where it is, and then you can see the knot sits deep underneath the tissue.
Okay, but I have a question. When you take this out, there's only one of this in here?
Mm-hmm. Yeah,
All
there's
the
only
time?
one. Yeah, there's only one suture per pack.
Oh.
Unless they come in like, they have bigger packs where it's just like 8 altogether.
And then my other question was, how do you take this out?
Oh, usually the needle is stuck in there, like right there or so, like half of it's sticking out, and then the rest of the tail is attached here, and then it comes around. Yeah, you'll see it in the other ones.
Alrighty.
Okay, so we'll leave that to the side. You'll pick up your...
Ooh, so mushy.
Yeah, it is.
Okay, so I hold this with my left, and I hold this.
Yep.
And
You'll want to pick that up, and then load it at a right angle-ish, maybe a little bit further ahead. Yeah, there you go.
Okay.
Yeah, you can push the needle a little bit forward to help you, and then usually you wanna load your needle at the tip, which makes it easier to drive. The further back you hold it, it becomes a little bit harder to sort of manage because, yeah, exactly. Because if you have the tip sticking out, it becomes a little bit more difficult to manage because you're pushing up against tissue and stuff. Okay. So, oh, and then you always want to hold your pickups like a pencil. Yeah, exactly.
Oh, that's interesting.
Yep.
Okay. So, does it matter if I start from here or here?
No, it doesn't. But because you're right-handed, it looks like you want to start on this, or
this
yeah, the bottom side, I guess. Yeah, seems a little bit easier.
Oh,
I
like
think.
this, right?
Yeah.
Okay, got it. All right. So remember you said don't pull back. Lift it up.
Yeah.
Then you go.
Come in deep, and then come out superficial, but don't come through the skin.
Whoops, went through this. That's too thin.
Yeah, and even if you spike the tissue a couple times with the needle, it doesn't really matter because it always heals. So the reverse cutting needles usually, so they poke through the skin, they slice through the skin, but sliced skin always heals. Stretched skin and whatever doesn't always necessarily heal as well.
In terms of the closeness to the superficial, is that, or the border is too close, huh?
No, that's okay. Yeah, you want it, they say, well, typically at the junction of the epidermis and the dermis, which here is like the brown and the pink, but you can come out a little bit lower than that. Okay. The closer you are to the edge, the higher the chance of sort of spitting through the skin. Oh, okay. But,
another question. Does it matter if I hold it here?
Usually you want to hold it further away because then you can see, because if you're holding it over it, you'll be blocking your vision towards the needle, yeah. Yep. So you can pull all the way through, or you can pull it like halfway through, leave it in there, and then re-grab the needle right away, which will save you half a step of like reloading it
I see what you're
and picking up. But now you can let go of the other side, and then go ahead and pick up the needle.
And how much do you leave?
Enough for it to not accidentally go through.
Okay. Is that okay?
Yeah, and then you can always pull it through more later, but you don't want to waste suture too.
Oopsies.
Because then the scrub tech will yell at you. Yep, you don't want to accidentally pull it through just like that. And then you want to go ahead and reload your needle.
Okay.
Good.
And then you want to...
And then the other side, yep, you want to... So with this one, you want to turn your wrist around like this, yeah, so then your needle comes in perpendicular to the tissue plane. See where it's going to be straight across, yep.
This is...
Yeah, good. Yep, you can tell you're into the muscle there, right? Because it like, you feel the tension difference, so in the dermis it's a lot thicker, so it feels a lot harder to push through, and in the muscle or in the fat it'll be easier. So yeah, that's a good bite. Typically we'll take a bigger bite, but that's a pretty good one for now. So just push through.
Does it matter if I come out this way or this way?
Typically you want to come out the same way. So because you started a little bit more on this side and then came to this way on the first one, then you want to come across on that side here and then come towards the same direction where you came in initially.
Like this?
Yeah. Because then both ends will be at the same place underneath the skin. Because if they come out at different places, then it'll distort the tissue when you tie them together. Awesome, awesome. Okay. So now you can drop your, drop the needle. You can drop the needle holder, or sorry, you can drop the pickup in your left hand, and then you can use your left hand to grab the suture itself. And then that'll be your long end. And then needle driver in between. Yeah. Grab the short end. Do you throw it over or under?
I went like this.
Oh, I think, well, that technically takes it under. Do it the other way where you put it, yeah, there we go. Over, and then come around again. And then grab it. Yep, and then pull through. Yep. Yep, and then you want to pull in that direction. That direction. Both of them. Yeah, that'll help cinch it down. Yeah, good. So I think it's a little off level there, but that's okay. And then you pull them both in that direction to cinch it down, and then you pull the long one back in this direction to lock it. Yeah, good. And then you can let go of the short side, and then take the long side, throw it over again.
This way?
Yeah, over the needle holder. Yep, and then grab the short side. Yep, and then pull it the opposite direction, downwards. Short side downwards. Yep, there you go. Good.
Okay.
And then same thing. Did you cinch it down all the way? Yeah, you did. Okay, I couldn't tell from the camera. All right, good. Grab the short side. Oh, if you grab the short side more towards the end, you won't have to drag the loop through there like that. So you want to pick up the short side from the end, and it pulls it through. Because you know how sometimes you pull it through and you have that loop that's stuck inside. Yeah, you won't have that if you loop over, and then grab the tip, close to the tip. Yeah, and then pull through. Yeah, so you don't have that loop you were playing around with before. Yep, and just do that a couple times. Yep, grab the tip, towards the tip, yeah. Typically we'll leave the tip a little bit shorter too, so it also doesn't become a problem like this when you're trying to tie it. And you save suture. Yep, however many times you want, and then you can cut it. And then for these, you typically don't leave a tail, so you can cut it right up against the knot.
When would you leave the tail?
Usually when it's on the outside. When people can play around with the tail or flick it or whatever and knock the suture out eventually, that's when we want to leave a tail and be careful. But when it's underneath, and it should hold with all the with the suture material and the number of knots that we're placing, we don't need to place
I'll do it again.
Extra tail. Cool, do it again. Okay, so Paula's finished her first set of sutures in there. So you see the first two are mine right in the middle there.
Right
so
there.
Those are approximated, and then that was Paula's first one. So it came apart a little bit because she didn't do a surgeon's knot. We didn't teach her that yet. So it's a little bit apart, but that's okay. And then the next one got a lot better, and the next one got a lot better, and then the end is a little slight, but that's okay. So we're gonna cut them all out and then start all over again. So we had to take a break to make dinner, but you can see the next few, so we cut all of them out, and then you can see the next few sutures that Paula put in, but they look pretty good. Edges are approximated. That last one looks like the top part's sticking up just a little bit, but otherwise doing really well.